Although you'll be receiving valuable advice from our host, please remember this is not therapy. It does not replace a relationship with a qualified mental health professional.
I'm Dr. G, and we are back on the air. As you know, we're here every Sunday from 8 to 9 p.m. If you want to call in tonight, the number is 1-800-222-5222, and we have a great show coming up. We're going to be talking about sexual addiction and sexual harassment. As you just saw on the Golden Globes, a lot of the women were wearing black to deal with some of the issues around sexual harassment. And when I was trying to understand it better and see if there was a connection between the two, between addiction and harassment, I thought, you know what, I'm just going to turn this over to my wonderful guests tonight. They each have an expertise in the area. I'm going to introduce them, and we're going to have a great I was saying, as our president, the best discussion around this topic. So I have Dr. Mimi Shagaga. She is a psychologist who specializes in the area of sexual addiction from a psychological point of view. I have Dr. Damon Raskin. He's an addiction specialist. And I have Kelly Holland, who is the CEO of Penthouse Magazine. I want to welcome you all to the show. So your opinions about addiction and harassment. Why don't we do a little short opinion, and then we'll just have a discussion around it. So, Dr. Mimi, why don't you start? Do you think there's a connection between addiction and harassment, and can you define them?
Okay. I think that there can be a connection between addiction and harassment. Let me just start by just putting my opinion about the topic.
Yeah, we want your opinion. That's what this whole show is about, is opinions.
Okay, so topic of sex addiction, highly debated. I subscribe to the theory that there is a phenomenon that exists. And I think that where a lot of people get caught up is in the terminology, using the word addiction. That might not be the best word to use to describe it, but there is a known phenomenon that's compulsive sexual behavior. I've seen it in my practice. I've worked with it. I've researched it. There's a lot of conflicting research right now in the medical community. I think that we still have a long way to go, but I do believe that it exists. And for lack of a better term, I use the term sex addiction. That being said, not all sex offenders are sex addicts, and not all sex addicts are sex offenders. I think that a lot of what we're seeing in the media, for example, Harvey Weinstein, even if you go back as far as Tiger Woods, these people who are using this terminology, claiming that they're sex addicts as an excuse for bad behavior, I don't necessarily see, again, I'll reiterate, I'm clearly not treating any of these individuals, but I don't necessarily see sex addict behavior from what we know about, for example, Harvey Weinstein. There's clearly a history there of sexual harassment, and there's a lot of power dynamics at play. That could be more attributable to something like narcissism. It doesn't necessarily mean he's a sex addict. And I do think that oftentimes people will claim that they're a sex addict in order to try to excuse bad behavior.
Yeah, I agree with you completely. I mean, when you look at the two, addiction is more of a compulsive behavior, and where a person feels like they can't control themselves, and sexual harassment is usually more of a personality issue.
Right.
The need for a narcissistic need for power, for control, and a lot of times money is used that way. Absolutely. And I do agree with everything you're saying, but we're going to go over to Dr. Raskin, and I'm curious, as a medical physician, addiction specialist, what your thoughts are around it.
Well, Howard, thank you. I actually agree with you that this is very controversial in the medical field, and as an addiction specialist, I don't believe at this point we have enough evidence to say that there is such a thing as sex addiction. We do know that there is such thing as hypersexual behaviors, and we do think in general that this what's called sex addiction is really a manifestation of, say, some stress, some post-traumatic disorders, some anxiety disorders, and this is a manifestation, just like we know anorexia and bulimia, those are eating disorders, but that's not about food. Right?
Right,
so,
it's about the emotional issues. And
the power and the control that you can take, and they do that with an eating disorder. Well, sexual addiction in this sense, or this behavior, is not necessarily about sex. It's about these traumas that they have to sort of recover and figure out what to do with. And so there's a lot that goes on there. And then if we call something sexual addiction, well, guess what happens? Well, then we start to have rehabs that make a lot of money on these, quote, sex addicts.
Right.
And they come up with these, treatments that don't necessarily apply to the regular model of addiction that we know apply to alcohol and other drugs.
Do you think there's I've read some research that there's a biological basis for possibly sex addiction?
Well, I do think that there's a biological basis to this process, but I think a lot of it may stem with underlying trauma or underlying unresolved anxiety and depression.
Okay, well, I think we all agree with that. And Kelly, Holland, why don't you take a stab at it?
Okay, as the one non-doctor on the panel here.
You're honorary doctor.
I want to say that in the world of adult, I have over 20 years run across the majority of people that are in the adult space will say when you interview them or talk to them that they grew up highly sexualized and they felt alienated from everything around them because they didn't know how to deal with that. They thought that there was something wrong with them or it was some indictment on their morality or whatever. And that's to many, to a great extent, what brought them into the adult space. And they will say, and I've heard this so many times that I take it as truth and a bit of a mantra for them, that when they came into the adult space, they felt like they finally came home because they were accepted for their level of sexuality. And so does that bridge into sex addiction? No, I think that it's truly biological and it's chemical. I mean, I believe any woman that deals with her hormones knows that there are times she's highly sexual and times that she's not. That's simply a chemical, that's a nature thing, not a nurture thing, and that's a chemical issue. And I don't think it has much to do with trauma or their history or some event or something in their, that's not a nurture issue. That's a nature issue. So let's take being highly sexual and put that to the side. Its connection to sexual harassment. I mean, look, I think you could do a whole show. You could do many shows on sexual harassment. You could do many shows on sex addiction. And I think we put a lot of things under the mantle or the definition of sexual harassment. You've got Roy Moore on one end of the spectrum, which is rape and pedophilia. You have Weinstein, who I see more as sexual assault. And then you have sexual harassment. I don't know. Yes, you have sexual harassment, people using their position of power, to gain control over people. And I think that it's less about sex and it's more about power and control. But I also think you have, the joke that was misunderstood, that had no ill intent, which is now being labeled as I was sexually harassed or put in a sexually compromised position. You have, the Louis C.K. thing. I don't want to underestimate how traumatic that may have been for the women who walked in and saw his penis, but I just look at how I would react to that. I would walk in and say, "Are you joking? Put that thing away."
Let me ask Dr.
Put it
Shagaga.
away.
Let me ask the other woman on the panel. How would you react to that?
Okay, so, and I'm over here smiling and nodding my head because the other issue at play, which I'm sure we're going to get into later in this conversation,
right?
It's accountability, right, on all ends. And without sounding insensitive, some of what we're hearing in these reports makes me question the accountability on the woman's end in some of these situations. Now, I'm very careful when I say this because I don't ever want to try to minimize someone's experience. And if it was a traumatic experience, I want to hear about it and I want to accept it. But I think that part of the problem now with all of these reports surfacing, it's just every day you're hearing a new accusation, a new person named in the media. Some of the reality, I think, is getting lost.
And I'm afraid we minimize to more serious situations with everything that comes out. And so I worry about the self-victimization that may be going on and the abdication of power and autonomy from women by saying, I felt like I couldn't do anything. Now, I also, it is a very difficult thing for a woman to talk about, very difficult for me to talk about. I take into account that I'm 5'10.5", And the world may look very different for me because I'm tall. The world may be very different for me because I am alpha by nature. So I don't underestimate the fact that women from a different background and different experiences may really feel assaulted by something like that. I just can't wrap my brain around it, frankly, though. I think I worry about self-victimization. I also worry about the sort of militarization of the accusation, and that can be used very irresponsibly. And I've seen a few cases recently where I feel that has
I want to go to an earlier point. We have about a minute left, and then we're going to go to commercial. We have the whole show to talk about this. But I've had a lot of patients come in who are trying to explore themselves sexually. And they go right away to this place of pathologizing their sexuality and say, well, I must be a sexual addict because I'm trying to explore myself or, in different ways than I'm used to. And that's my concern about always labeling someone with an addiction, that you might very quickly pathologize something that's very healthy for them to do. So, I think, and that adds to the shame a lot of the experience, is if you go into an addiction, then they feel there's something wrong with them. So it's a fine line. I'm not always sure, how to define it, but I think it's a case-by-case basis for me, at least. That's my experience.
And I'm sure you know that the manual, the God sort of, book that discusses diagnoses for psychiatrists doesn't even label sexual addiction as a true disease.
It's not even considered an illness.
And so we have to be very careful, like you said, labeling someone as a sex addict if it doesn't really exist. I mean, what are we talking about, really? We're talking about a behavior. We're talking about hypersexuality or things that we may not even understand yet scientifically, but we need to label this correctly.
Okay, that's great. We're going to come back after the commercial, and if you want to call in, it's 1-800-222-5222. I'm here with Dr. Mimi Shagaga, Dr. Damon Raskin, and Kelly Holland, and we're talking about sex addiction and sexual harassment.
Welcome back to Engaging Minds with your host, Dr. Howard Gluss, licensed clinical psychologist.
I'm Dr. G, and we're back with Engaging Minds. We're talking about sexual addiction and sexual harassment. And I want to address something with Kelly Holland. As you know, she's the owner of Penthouse Magazine and Global Enterprises. Her opinion and experience of sexual harassment in the adult world. I wonder if you could elaborate on that and what your thoughts are on it.
Sure. It's an interesting concept to think about actors that show up and their job is to have sex, and can, in that environment, sexual harassment take place. Yes, it can, by crew members, by directors. There's a quid pro quo and a casting couch. You have sex with me and I'm going to put you in a movie. That happens. However, I think the underlying counsel that I would give to all actors, men and women, is that at the end of the day, they need to control their environment, and they need to be willing to say no and walk away from a job if anything is making them uncomfortable. Forget sexual harassment. Forget that you feel someone said something inappropriate. I've been on sets for 20 years, and there is a protocol on a set. When an actress is there getting into makeup, that's not the time that you come up and joke with her or touch her. I've had rules on sets for 20 years that crew should never have personal conversations with talent. Whether you think it's okay, they're your friend, you know them or not, don't put them in a compromised situation. Now, I will tell you, when you're working with two actors are working together, particularly if they don't know each other, there's a moment after they're in makeup and they're ready to go where they'll step off to the side, and she may start kissing him or touching him because she's prepping him for a scene. That's part of what happens on the set. That's actor to actor.
Right.
What's probably more common on a set, it's not sexual harassment, but that actors are pushed to do things that they're not comfortable with. So, for example, I tell all actors, if you have never done this in your personal life, don't do it for the first time on a set, no matter what it is. If it's not something, if there's an actor on a set and you show up and your job is to do a scene with that actor and have sex with that actor, and for whatever reason something happens and you're not comfortable, you see something physically with that actor, or you get a sense that actor was drinking too much or did drugs the night before, or you heard something, whatever it is, he's wearing a plaid shirt and you don't like plaid. I don't care what it is. If you are not comfortable moving forward with that scene where you're going to be having sex with that performer, then say, guys, I'm calling it today. That's where you have problems on adult sets, is actors get into a situation where they're uncomfortable having sex for whatever reason, rational or irrational, and director says, wait a minute, thousands of dollars are going to go down today if you call this scene, and the actor gets pressured to do the job. But you would have a similar situation,
I was
a
just going to
stunt
say
person,
that.
for example.
Yeah, it's your personal truth.
Or
whatever is
anybody,
uncomfortable. Right.
Yeah, anybody going in to do any job, a diver that's going to go down and says, you know what, the waters are too choppy, I don't feel comfortable going in today, and someone says, well, you're going to cost us a lot of money. So that's a very different situation than sexual harassment on a set.
Go ahead, Dr. Raskin.
No, I agree. I think that you have to be comfortable and you have to live your truth, and I think that that's very, very important. And I mean, it's not necessarily a medical issue, but it's a behavioral issue, and I think it's a psychological issue, and you do have to stick up for yourself.
I think that's exactly what Kelly's saying, is that it's your personal truth. If it's not something you're comfortable with, that's when it becomes harassing. The tricky part is, when do you say it? When are you willing to take a risk and walk away from something you really wanted? That's a hard choice to make. And
or walk away from money that you need.
Right.
I mean, this is the basis of capitalism and the economy, that people do things all the time that they would rather not do, and it's called a job. Now, when you get into that situation and an actress chooses to have sex with a director, and I'm not talking about in the adult space necessarily, but in all spaces, and she chooses to go along with the go along because she wants that job, then, as you were saying, there's a mutual responsibility. Both sides need to own inappropriate behavior and the fact that you were willing to do that because you wanted the outcome.
And I wanted to mention, you talked about the beginning about all these different kinds of cases of sexual harassment, and a lot of times when something comes to the forefront, especially psychologically so intensely, we haven't had a chance yet to differentiate it. And I believe that'll probably be the next stage. There's a big difference between what some of the men are accused of and what other men are accused of. And to lump everyone together, I believe, is unfair. But that's probably going to start to happen, is that differentiation. So, I think, do you think this is something that's going to last? And do you think it's a movement that's going to really change people and change the industry? Or what about in the medical field?
Yeah, I mean, I think that I have patients that come in now and start talking to me a little bit about, what will you give me disability because I feel stressed out on my job because my boss has been harassing me that I haven't seen in several years, and it's coming to light. And I'm going, well, yeah, I mean, it's interesting that it's coming out now, just like we're hearing more and more. It's almost like we're getting a little bit desensitized at this point because there's been so much in the media. Every day, like you said, we're hearing about a new person who's doing some harassing. And is it just harassment, and what is really going on? Is it assault? Is it just sexual innuendo? And we need to know to really be able to say, well, yeah, you should get disability and not have to work because of this person.
Yeah, I've had the exact same experience as a psychologist. People coming in wanting disability because, and I think that's a really bad thing, because then they take the purity and what's good about what's going on right now and they abuse it. I'm wondering if you had similar experience.
Right, absolutely. Well, that's what I was speaking to before, that I think that the problem in this, and as Kelly was saying too, is that things get lost in the shuffle, I think. And as you were saying, in reality, there is a lot of harassment going on. There have been assaults that have happened. These things exist. I mean, and not just in the film industry, in all industries, right? And I think that it's great, even the campaign that's happening tonight, the Time's Up campaign as we speak right now at the Golden Globes. It's great because it brings light to an inequality, and not just for women, but for men, for, the LGBTQ community, anyone who has an alternative type of lifestyle as well. But I think that some of this positive message gets lost in all of this.
Some victims get lost in this because we are going to become deafened to this because the noise level, and I don't say noise in a negative way, but the outrage level has risen to such a peak that I think that a lot of victims will get lost in the pushback to this, and but it's a pendulum.
Yeah.
It's a pendulum, right? So all in, net, this is an incredible positive because women are emboldened and they're empowered to talk about things that they hadn't talked about before. What's tragic, and I always beat the same drum, the reason I love the adult industry is they've been talking about their sexuality for so long, and they're so comfortable talking about it. Obviously, they're on camera having sex, and I love them for that. What is tragic is that we are in 2018, and there are so many women who only now are coming out and saying, I was assaulted, but I was embarrassed to talk about it, and then or I was raped, or I was groped as a child in the Roy Moore case, and only now, 40 years later, am I comfortable and I will not be shamed. That's the tragedy, is that it took till 2018 or 2017-18
right,
to come out and have women feel emboldened because they have the collective voice of all women to talk about that. Like I said, that's why I love the adult industry, because they've been out. They don't care. They're just like, this is what I'm doing. What do you want to say about it? And I love them for that.
And then I also think what's kind of tragic is this, now that the assaulters are saying, oh, well, it's because I have an addiction.
Exactly.
And then they go
That's
off, go off and hide in a rehab center, and they hope that in a few months it'll all get blown away.
Yeah, suddenly we're supposed to be empathetic towards Harvey Weinstein because
he has an addiction.
I bet he doesn't even have a clue what that means.
Right.
Exactly.
And then they're hiding behind the disorder, and then the people who really have an issue, a struggle with compulsive sexual behavior, are being lumped into that category. We have a minute left. I'm thinking, I run a group for men. And one of the issues that the men have been talking around this is they'll say, well, I was socialized to behave this way. Mm-hmm. This was acceptable behavior. These are guys that are in their, let's say, 60s. This is the way I was brought up. And I didn't even realize that I was doing something that was hurting women. And this is a lot of times what the manly thing was to do, what was expected of me. I think that's pretty interesting, too, and a generational issue.
I feel so. I say this in all sincerity. I actually feel sorry for men in general. It's a tough time. This is a tough
Dr.
time.
Raskin, it's a tough time
to be a guy.
It can be.
It's confusing.
It's incredible. And we've talked about this before.
Yeah.
You've got a reptile brain that's been driving you for 126,000 years to do it one way, and in 3 generations, you have to flip the script. And I think it's important just to say, on that continuum, rape, sexual assault, sexual harassment, and then just being a dope. Like just bad behavior in general. Being the rude guy at the party, right?
I was at my cleaners today, my dry cleaners. I picked up something, and the girl I know pretty well, she looked really pretty. I said, oh, you look really pretty. And then I looked at her, I said, am I allowed saying that anymore? And she said, of course, I appreciate the compliment, but it did cross my mind.
She may, but there's other people, there are other women who might say, no, that's really inappropriate.
Yeah. We're going to talk more about that after the break. I'm Dr. G. We're here with Engaging Minds. Our number is 1-800-222-5222.
Welcome back to Engaging Minds with your host, Dr. Howard Gluss, licensed clinical psychologist.
I'm Dr. G, and we're back with the show, and we're here with Dr. Mimi Shagaga, Dr. Damon Raskin, and Kelly Holland. And at the break, we were talking about this concept of healthy sexuality, sexual addiction, sexual harassment. I think the most important thing that I want our audience to get is we have to differentiate between what these issues are and the severity of them and the levels of abuse. As Kelly Holland said at the break, it's very different if you have someone like a Roy Moore who is chasing 15-year-old girls in the mall versus somebody who maybe makes a comment about someone's appearance, and that's considered lumped into the same category as considered sexual harassment. So I'm wondering, Dr. Shagaga, you said at the break you want to talk about healthy sexuality. That this issue doesn't turn into people adding more shame to their experience of sexuality.
Right. I think that, from a clinical perspective, what we're seeing with a lot, I think on both ends, right? Like some of these women who were victimized and some of the, let's just use the term offenders for the more severe instances, right? I think that on a societal level, we are very sexually repressed, which a lot of people, whenever I say that, kind of, they laugh, what do you mean? There's porn everywhere. The internet makes everything so accessible. There's sex on television. But we really are. I mean, it becomes more and more evident to me all of the time in my clinical work how shamed a lot of people are about their sexuality. And I think that can lead to a clinical degree of repression, and then it's going to surface in one way or another. It will manifest itself, whether it ends up being, through an actual offense or through shame, and then there's depression that accompanies the shame. I think that if people embraced their sexuality in a more healthy way, that we would probably have fewer issues like this.
Oh, I agree completely. I mean, in my clinical practice, I have men all the time coming to me asking me for STD tests, and I go, okay, sure, what's going on, what happened? Well, I went to a strip club and this woman kissed me, and I'm like, well, can you check me for AIDS? I'm like, what are you talking about? So this is grown, men coming in. They're feeling upset. They're feeling shame. They're feeling guilt. So they want to come to the doctor and get an AIDS test. Like that's going to make it all go away. So it's exactly what you're saying, that there's a lot of misinformation, a lot of repression, a lot of misunderstandings. And I think that's important that we get that out.
This is the schizophrenia of the sexual climate in the United States.
I was thinking of the sexual revolution.
Where did it go? Right. Because we're drowning in sexual images and sexuality around us, but we are absolutely uncomfortable in talking about our own sexuality. It's very fine to watch it and to comment on it and to see it and have it on every billboard, but when you talk to a woman and say, when was the last time you had an orgasm with your husband? Well, that's a different subject. Then you have to get into a very deep conversation, and it will slowly begin to spill out that, well, I've actually never had an orgasm with my husband. Have you ever told your husband that? I could never tell him that. So it's that sort of intimate honesty that can't happen in this society, which is probably why we have such a tsunami of sort of cheap sexuality that we're surrounded by, because that's just an easier way to have it in our lives.
And I think that the harassment issue for a lot of men is because of sexual repression. And we notice a lot of times, you take on the opposite characteristic of that's what you're trying to experience. So a lot of times your own aggression, your own, let's say, self-hatred or feelings about sexuality get turned into harassment towards somebody else. So we project it out into the world. So hopefully this will also change some of our attitudes towards sex and open up the discussion again.
And then there's just inappropriate behavior.
Yes,
I would even
behavior.
let it rise to the level of sexual harassment.
Do you want to share some of your feelings about Harvey Weinstein?
Yeah, no, because you know what? I think he's an assaulter. I put him in the assault category. And I do believe that there's really conscious sexual harassment, a use of your power to achieve sexual ends and to exploit people who you can hold that over. But then there's just the dopey guy. There's the dopey guy syndrome. The guy that just is at the party or is in the office and makes a joke and thinks he's funny, and it's an inappropriate joke with women in the room or with a woman that he's talking to. There's the, hey, you look great in those high heels kind of thing that goes on.
Right.
And it's just dumb.
Right.
And I think everybody kind of laughs and giggles and goes along just to keep the peace. I think now we're at a point, I think now the pendulum swings way to the other side where women whip around and go, how dare you say that to me? Okay, I get it, fair. But there will come a time when we can all kind of come back to the center when a woman might say, come on, just don't be a dope. And the guy might go, oh, you're right, I'm not. But I think now we've got these opposite ends that are sort of clashing with each other. But I think it's all good. It's all healthy. Listen, every movement has to be radical in its first moments. And I think, there has to be this kind of explosion right now. And now it will settle and we will come to a better place. This is how all cultural movements leap forward. They lurch forward. They don't just gracefully dance forward. They lurch forward, they get their balance, and then they settle in. And then, in a year or two, there'll be something else and they'll lurch forward. LGBT community has gone through this. And much to everyone's credit now. I mean, it's now we're much more comfortable in that space, and the LGBT community is much more comfortable in their conversations and in their position in that space. It's just it's the evolution of our culture and hopefully of our thinking.
I agree with you completely. And one of the things I wanted to bring up, and Kelly, I know you said that Penthouse is doing an article on this subject.
Camille Paglia on self-victimization. She's that kind of third gen, for people that don't know who Camille Paglia is, and I love her. She's kind of that third generation feminist, third, fourth, I don't know what generation feminist, starting with, Andrea Dworkin being the first generation who believed that all sex was rape, right? So, we've come along. So Camille Paglia, has said, in this article, that women need to, claim their power and understand their ability to accept what they want to accept and reject what is appropriate to be rejected, and that women have to understand that they need to claim their power in this time, and not feel that not live in the past of their own self-victimization about what was happening and what they were accepting, essentially.
I couldn't agree with you more. And I wanted to, I think we all have to do that, not live in the past and act as victims, but see where this new insight's going to take us. I wanted to add something to the addiction issue that I wanted our audience to understand, is that a lot of times when we're talking about addiction, we're talking about what we call in our field, dual diagnosis, or many different issues going on at one time. And to just claim that someone has a sexual addiction, a lot of times we're missing some of the other issues. So I wondered if Dr. Raskin can comment on that.
Absolutely.
Multifaceted diagnoses.
Oh, absolutely.
Yeah.
I see all the time that people who come in with these hypersexual behavior disorders also have alcohol issues,
Exactly.
or they have other drug issues with opiates or other drugs. And they may also, in fact, have psychiatric diagnoses like major depressive disorder or other anxiety
Bipolar
disorders.
disorder,
Absolutely.
right.
So these things are so common to be conjoined that it sometimes is hard to separate what came first. And a lot of times I believe that some of these sexual behaviors are a manifestation of them trying to escape or self-medicate their way out of some of these anxiety disorders, for example. And that's what I see very commonly in my practice.
And Dr. Shagaga?
No, I would absolutely agree with that statement. I have had people come to me completely self-diagnosed. I'm a sex addict. Can you help me? And then come to find out, I mean, they really, if it were a formally recognized disorder, they wouldn't meet the criteria.
And that's the key. It's not, as of yet, a formalized, recognized disorder.
Absolutely, yeah. But I think that, this whole issue, right, it speaks to everything that we're discussing about the harassment and everything. So much of the way we view these things, it's social constructs, right, societal constructs. What lens are we looking at the situation through? And I think that a lot of people, they hear the word, or the term, rather, sex addict. Oh, Harvey Weinstein's a sex addict. Oh, Tiger Woods is a sex addict. I must be a sex addict because I cheated on my wife. I must be a sex addict because I like porn. There's a difference between excessive use, repeated use that's interfering with their occupational functioning, that's interfering tremendously with their relationships that they're spending.
We have to take a quick break, but I want to talk about that more, because actually I thought the Tiger Woods case was interesting, because even though he was cheating on, he did have some accountability. He was not really sexually harassing at all. It was more an issue of the issues that were going on in his relationship. I'm Dr. G. We'll be back right after the commercial. If you want to call in, it's 1-800-222-5222.
Welcome back to Engaging Minds with your host, Dr. Howard Gluss, licensed clinical psychologist.
I'm Dr. G, and we're back with Engaging Minds. And before I bring my panel back on, I wanted to mention that we have a new sponsor that's starting on this show, and I want to welcome them to our family. It's Mid-Valley Hospice in Sherman Oaks. So if you're looking for compassionate care and hospice care, you should contact Mid-Valley Hospice at 818 403-3940. And one of the reasons I want to mention that I really support them is that they are supporters of the End of Life Option Act, which gives qualified patients the ability to obtain prescriptions for end-of-life issues. So again, if that's something you have one of your loved ones facing and want to connect to a non-judgmental hospice care, it's Mid-Valley at 818-403-3940. And I did want to mention that Dr. Damon Raskin, who's on our show right now, is their medical director. So can you just explain very quickly what that means? And we're going to have a show about it next week.
Sure. Well, hospice is a philosophy. Some people think it's a place you go. It's not. Hospice is a compassionate way of dealing with terminal cases where patients have a diagnosis where they have 6 months of life left or less, and it's about quality of life and about taking care of relieving pain and suffering and anxiety and those types of issues rather than focusing on just continuing to let the patient suffer. And having this end-of-life option, which California has agreed to, allows patients that option. That gives them their right to terminate their life if they qualify, if they have those qualifications. And I think it's a very compassionate way and a dignified thing to do to respect patients and their wishes.
And we're going to, again, like I mentioned, we're going to have a whole show dedicated to that next week. But it does sort of connect to what we're talking about a little bit here, where people's truth and that people are entitled to follow their own truth. And what Kelly said earlier on about, what determines sexual harassment is what is in conflict with your own personal truth. And that's what I think is so great about this. But Kelly, you said at the break there was a French therapist that you wanted to talk a little bit about her concept. I don't think any of us could remember.
Oh, are we doing a show now on polygamy, or the monogamy is not realistic? You know what?
Sure.
I feel
not?
terrible talking about her because actually I think she's French Canadian because I can't remember her name, but she wrote a brilliant book called Mating in Captivity, and all of the biological imperatives that are in direct contradiction to a monogamous relationship. What we want what we are attracted to and sexually attracted to is mystery and uncertainty and a little bit of danger. That's what we're chasing sexually. But then, of course, what we want in a long-term partner is predictability and stability and, knowing that they're always there under all circumstances. But then that translates into boredom. So, it's just the difficulty. So that came about. We were talking about that on the break because I think you were talking about the fact that Mimi was talking about the fact that people who perhaps are cheating on their spouses might think that they have a sexual addiction, and I believe that is also a common conversation that will come up in therapy. Is don't blame me so much on this because I have a sexual addiction, and I was saying that that's to me inconsistent with the idea that you don't have a sexual addiction. Monogamy is a very high bar to try to live up to for 10, 20, 30, 40, 50 years. I've never made it past 8, frankly. Actually, 8 was the relationship. I didn't make it past about the 4-year monogamous point.
But you see, I think how this connects is that just by us talking about addiction and harassment, we've opened up the dialogue to talk about sexuality and that it's all interconnected, that it all has to do with our opinions or feelings about monogamy or sexual identity. It all gets talked about one more time and maybe another truth happens.
Right.
That's why I think it's all interconnected.
Yeah, absolutely. Well, and I think that is one positive, right? That as you were saying before, right, Dr. Gluss, that this movement, if you will, it is creating at least the beginnings of a discussion about sex and sexuality. And I think further to Kelly's comment about the self-diagnosed sex addict who's cheating on his wife. And again, this goes back to the idea of not repressing sexuality and having a healthy view of our own sexuality and being able to speak openly about sex and talk about it and explore in a healthy way. And I think that the term sex addict can sometimes lead to the pathology or the pathologization of what might be healthy sexual exploration. Not
right.
everyone is monogamous. Some people are into alternative lifestyles, such as polyamory, and there's nothing wrong with that.
And I'm sitting next to Kelly, and I'm thinking, pornography is some people think, oh my God, I have a problem because I look at pornography on the internet or magazines or movies, and it doesn't necessarily mean because you do that you have a problem at all or that you have an addiction. In fact, it can be extremely healthy and very, very normal. And I have patients that get very frustrated about it or upset about it. It's a woman that coming in, oh, my husband, I found a pornographic magazine. I'm like, well, is he having sex with you? Yeah. Well, then, is it a problem? Is he doing it all the time? Well, I don't think so. Well, is it taking him away from his job or from you or no, or the kids? No. Okay. Well, it may not necessarily be a addiction, and that's what I try to convey.
Maybe it could be something positive that you integrate into your relationship.
Exactly. And did you, to the woman, you can say, did you go watch 50 Shades of Grey, or did you read it? Did that turn you on? Did that then make you want to try some new things with your partner? And by the way, if I can just give a shout out to the woman that wrote Mating in Captivity, her name is Esther Perel, Esther Perel. She's written some other books too. Yeah. She's marvelous. Yeah. If you ever have a chance to listen to her speak, she's really incredible. But I didn't want to just refer to her as the French.
I appreciate that.
French Canadian whose name I could not remember.
Yeah. Again, I think what's so great about let's talk about that. We talked about that a little bit at the break. The idea of differentiating between sexual addiction and maybe pornography addiction. Any thoughts on that, Kelly?
Well, I think we're all talking about whether that sex addiction is actually not considered to be a pathology. I would say that there's probably more of an issue with porn addiction. Now, I don't tread into that too deeply because that's used by the right to really condemn pornography. And pornography, for me, if it's not misogynistic, is a useful tool and a great medium for people. But I do think that people, they can become addicted to video games. They can become addicted to television. They can become addicted to porn as a way to disengage from actual interaction with other people. And that then becomes problematic, or it becomes problematic if they end up staying home all day to watch porn and they're not going to work. Obviously, those are some of the definers of an addiction. Where does it become an addiction? So I think it exists. I don't think it's common. There's been sort of mixed studies out there. Generally, when the religious right does the study, they'll tell you there's a lot of porn addiction, or when the Mormon church is behind the study, they'll tell you there's a lot of porn addiction. But I think neutral third-party studies don't show that that's a very common thing. Certainly, I'll tell you what's more common is addiction to video games is much more common.
I agree with that. We once did a show on that, and that's exactly what the numbers came up with, that video game addiction was more severe. But it goes along with what we've talked about here to the two docs, that many times the issues are related to high levels of depression and anxiety, and the acting out behavior just goes around porn. It could go around other substances or shopping or gambling, any process-related addiction. So it's just pretty much what you do with those issues and where you decide to focus your addiction. And that's what needs to be dealt with. What's the underlying issue? Can
I say one word?
Yeah, absolutely.
Alienation. Yes, it's depression and all of that, but underneath all of that, I think, is just this incredible alienation, which is also kind of symptomatic of our culture, particularly in the United States, which is so polarized.
And, with the few minutes left, one of the things I wanted our audience to get, and this is why I love having the three of you together, is to understand that this is a very complex issue, and we're just skimming the surface on it. And a lot of times there's many issues related. There are health issues related. There are other psychological issues. And the issue of harassment needs to be differentiated and broken down to. But as Kelly said, the wave started and we'll see where it goes. But I think the most important thing is that we're talking about it. And a dialogue has started, and hopefully it will continue. With the time left, any parting thoughts, Dr. Mimi? That says it all.
I could talk about this all night.
I know, really.
No, I think it was a great discussion. And like you said, I mean, we really, really are just scratching the surface with this because it's such a socio-political topic, and there's
so much to talk about here.
Absolutely.
But thank you, Dr. Damon.
No, I think this is, again, a great conversation, a great way of sort of bringing it out into the air, into the open. And if you do think that you're out there and you do have an issue or a question or a concern that you might have some addiction, whether it's to pornography or a sex addiction, please bring it up. Talk to a professional, whether it's a psychologist who specializes in an addiction specialist like myself, or even your general internist. Bring it up and have it come out there, and it's a confidential thing to talk about it with your therapist or with your internist. And I think it's very, very important to bring it up.
And Kelly?
Yeah, you know what's wonderful about this, no matter how far to one side or the other the pendulum swings, is that change never happens in Washington. Change is never legislated. It happens in the street. It happens when the dialogue starts. For good or for bad, it happens. At the very least, I don't want to say at the very least, because I think there's a lot of very mosts in this space with the conversations about sexual harassment and sexual assault and rape. But you've seen now it's necessitated change in Washington. So now where legislators used to be able to, there was a slush fund and they could pay people to go away who were making claims. Now that's all emerging, and I think that's a great thing.
And hopefully there'll be lots of discussions like this happening all over the country. I want to thank you all for coming on the show. I'm Dr. G. We'll be back next week. As I mentioned, next week we're going to be talking about the right to die issue here in California and the complexity of that issue. And that'll create some social change too. I'm Dr. G. If you want to email me, it's drhowardgluss@live.com.